Hello everyone, in today's session we have Dr. Harish, who is a consultant neurosurgeon at Vikram Hospitals, Bangalore, a unit of Manipal Hospitals. Hello doctor.
Hi, hello everyone.
So in today's topic, our discussion is going to be about endoscopic skull base surgery. So doctor, let's start with some basic questions. What exactly is endoscopic skull base surgery?
Yeah, so endoscopic skull base surgery consists of operating on pathologies at the base of the skull by entering the nose with sophisticated equipment specially meant for these kind of surgeries, including the endoscope. Now previously many of these conditions used to be treated by a craniotomy, that means opening the skull, but with advances in surgical instrumentation and development of surgical microanatomy and endoscopic anatomy, now we are able to treat many of these conditions by performing the surgery with the endoscope and specialized equipment through the nose.
So doctor, how is endoscopic skull base surgery made safe?
So as I said, endoscope provides a distinct advantage of brilliant illumination as well as magnification, which are necessary to perform delicate microscopic surgeries and dissections. Apart from these, there are plenty of adjuncts that we use to make the surgery even more safe, such as use of neuronavigation, which is nothing but it is like a GPS system within the operative field, including the brain. So it tells us exactly where we are while performing the surgery. Other such adjuncts include very highly sophisticated drills and micro drills, CUSA, which is used for removing the tumor very delicately without disturbing the normal structures, micro Doppler, which precisely localizes the important blood vessels which are related to the tumors in these locations. Apart from this, the expertise and experience that we have gained while working as a team, we work as two surgeons, four-hand technique it is called as. Even though there are only two small openings in the form of two nostrils available, we have developed techniques where two surgeons can simultaneously operate with using both hands of each surgeon. So it's called two nostril four hand technique, which allows to perform safe micro dissections. Now a combination of these factors makes the endoscopic skull base surgery very safe as well as effective.
So doctor, who needs the surgery?
Yeah, a host of conditions can now be treated using this surgical technique. Now the most common indication for this type of surgery, that is endoscopic skull base surgery, are a group of tumors called pituitary adenomas, which are one of the most common tumors in the brain. Apart from pituitary adenomas, we use it for different pathologies such as CSF rhinorrhea. That means it's a condition where cerebrospinal fluid or a type of fluid which is normally circulating in the brain leaks through the nose. That needs to be repaired surgically to stop the leak and prevent the chance of infection going into the brain and causing meningitis. So this can be very effectively handled by endoscopic skull base surgical techniques. Other conditions which can be treated with this surgical technique include skull base tumors such as craniopharyngiomas, meningiomas, cardomas. These are various skull base tumors which arise, which are not as common as pituitary tumors, but nevertheless are frequently seen in neurosurgical practice. And sometimes sinonasal malignancies, that means cancers arising in and around the nose, which extend sometimes to involve the skull base. Many of these pathologies can be very effectively managed with modern day endoscopic skull base surgery.
So doctor, how long is the hospitalization once the patient undergoes the surgery?
It's about 4 to 5 days usually. The healing is faster and patients usually do not have external scar over the head or the face. But even then the tissues within the nose require some time to heal. So we generally discharge patients on 4th or 5th post-operative day.
So doctor, what will be the quality of life of the patient post-surgery?
Almost normal. In fact, patients who undergo this type of surgery can perform any activity which they were performing before the surgery. Probably, yeah, over a period of 2 to 3 weeks, I would say, they should be back to almost what they were doing before. Patients who need to undergo endoscopic skull base surgery have absolutely nothing to fear. It is one of the safe and effective procedures within modern day neurosurgical practice, and as a rule, almost all the patients undergoing this type of surgery should be back to their normal life without any major hassles.
Thank you so much for watching with us. This is Dr. Harish, consultant neurosurgeon at Vikram Hospitals. For more queries, please check our website.